Ladies, I've got some really important information for you in this video. I'm Catherine. Welcome to the Inspired Vitality Show. Today, I'm honoring National Hereditary Breast and Ovarian Cancer Week, as well as National Previvor Day. And because it is Ovarian Cancer Awareness Month, I'm going to take a deep dive into ovarian cancer, which ranks 5th in cancer deaths among women and causes more deaths among any other gynecological cancer. Last week, I published a video about the 5 main types of gynecological cancer. So if you missed that one, don't worry, I'll put a link in this video's description. First, however, today is National Previvor Day. It is held on the last Wednesday in September. Previvor refers to people at high genetic risk who have not yet experienced cancer. Whether or not a person identifies as a previvor, the term has been helpful for raising awareness. National Previvor Day falls on the Wednesday of Hereditary Breast and Ovarian Cancer Week, which is the final week in September, joining the Ovarian and Breast Cancer Awareness Months. Some organizations, such as Facing Our Risk of Cancer Empowered, known as FORCE, have grown to support individuals and families facing other hereditary cancers as well. They view it as a time to inform people about hereditary cancer and the steps that they might take to protect their health, as well as recognizing and honoring those who have been affected by hereditary cancer. Now let's take that deep dive into ovarian cancer. According to the American Cancer Society, the risk of a woman getting ovarian cancer is about 1 in 78 in her lifetime. Ovarian cancer may be used as an umbrella term to describe cancers that begin in the cells of the ovary, fallopian tube, or peritoneum. This is because it may be unclear where the cancer started. The cancers are closely related and are generally treated the same way. As you know, the ovaries are part of a woman's reproductive system. Ovaries are the primary source of estrogen and progesterone. These hormones influence breast growth, body shape, body hair, and regulate the menstrual cycle and pregnancy. During and after menopause, the ovaries stop releasing eggs and producing certain hormones. The fallopian tubes are small ducts that connect the ovaries to the uterus. During a woman's monthly ovulation, usually an egg is released from one ovary and travels through a fallopian tube to the uterus. Peritoneum is a tissue that lines the abdomen and most of the organs in the abdomen. The tissue covers the uterus, bladder, rectum, and the ovaries and fallopian tubes. A liquid called the peritoneal fluid covers the tissue's surface. This liquid helps the organs move within the abdomen and prevents them from sticking together. Epithelial carcinoma is a type of ovarian cancer that makes up 85% to 90% of these cancers. There are several types, and there can be differences in how these cancers behave and which treatments will work best. Recent research studies suggest that most ovarian cancers are high-grade cancers, most of which arise in or from the fallopian tube. Low-grade carcinoma is less common and may arise from the ovaries. About 70% of epithelial ovarian cancer, particularly high-grade, are not found until the disease is in an advanced stage and has spread to other parts of the body, most commonly the abdomen. Going forward in this video, for the most part, I'm going to use the umbrella term of ovarian cancer for all cancers affecting the ovary, fallopian tubes, and peritoneum. Well, early detection and treatment is important. This is often not possible for ovarian cancer. Symptoms are not specific to ovarian cancer and may be caused by a different medical condition that is not cancer. The annual Pap test that many women receive from their gynecologist does not check for ovarian cancer. It only identifies cervical cancer. Symptoms for ovarian cancer are many and varied. Some of them include abdominal bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, urinary symptoms such as urgency and frequency, fatigue, upset stomach, indigestion, back pain, pain with intercourse, constipation, menstrual irregularities, swelling in the pelvis or abdomen, and vaginal discharge, which may be clear, white, or tinged with blood. It is really important for women to acknowledge these symptoms if they begin and are different from what is normal for their bodies. Women who have any of the symptoms every day for more than a few weeks should see their healthcare provider. Treatment can include surgery and systemic therapy, including chemotherapy, targeted therapy, and hormone therapy. Ovarian cancer often goes untreated until the disease has advanced. The survival rate is low, with a 5-year survival rate of only 49.1%. Risk factors for developing ovarian cancer include family history and the presence of inherited gene mutations, which is why it's part of Hereditary Cancer Week. Other risk factors include the use of estrogen-only hormone replacement therapy and the use of fertility drugs. There are tests that can detect mutations in the BRCA1 and the BRCA2 genes, which increase the risk of female breast and ovarian cancers and some additional types of cancer. Other factors that might increase a woman's risk for ovarian cancer can include being overweight or obese, having childbirth later in life or never having had a full-term pregnancy, hormone replacement therapy, fertility treatment, and smoking. If there is anything that I want you to take away from this video, it's pay attention to fatigue and changes in bowel or urinary tract movements. If the symptoms persist, get worse, or aren't getting better with any other treatments, please raise the possibility of ovarian cancer with your doctor. Let me know in the comments of this video if this information has been helpful. See you soon.